Hello, this is Jose Lopez, Dr. Lopez. I am the professor for counseling theories, and I am so glad that you are taking my class. This is an online class. So while we won't be meeting, do like to create videos to help my students succeed through some of these online platforms. This is my first adjunct class here at Southeastern Oklahoma, and I am really excited to be teaching counseling theories. I think theories is one of the foundations for really at the master's as well as the doctorate level courses that really have stood out for me, not only for the theological or the conceptual framework, but really to serve as a guide in working with the different populations that I've been working with. A little bit about myself. I received my PhD from Texas A&M Commerce in Counseling Education. My dissertation specialized in the counselors who work with the Spanish-speaking clients. I am bilingual, and one of my research interests has always been to look at how language affects the counseling process. One of the things that, or one of the variables that I looked at in my dissertation was to look at um, the clinical language and how that looks with clients that are Spanish dominant, because just like in English, there is a therapeutic language, and at the university level, there's very few programs that teach the clinical language for Spanish, even though we have about 42 million Spanish speakers in the United States. The United States is actually the second highest nation in the world of Spanish speakers. They surpassed Spain in the 2010 census, the first being Mexico. But anyhow, a little bit about myself. I live here in Dallas, Texas. Um, I was born in Mexico. Most of my extended family, cousins, aunts, still live in that area. I was born specifically in central Mexico in a state called San Luis Potosí, in the capital of that state. I came here when I was a toddler, about 2, 3 years old, and we moved to Dallas. Into a neighborhood called Little Mexico, which is now uptown, very close to downtown, for those familiar with the city of Dallas. Went to high school in Richardson, just north of Dallas. Graduated from there, then went to a university just north of Austin, Southwestern. Studied psychology. After college, I was a bilingual teacher, taught fourth and second grade for 5 years, and I got a master's in teaching um, at Texas Women's University, and then I pursued a master's in counseling, where I became a certified school counselor, as well as started my LPC intern hours. From there, I decided to continue on to the doctoral program, um, and that's where I completed my coursework 2017. So as mentioned, I've worked in the schools. I currently work in the schools. I have 5 years experience as a bilingual teacher. Um, I have 3 years, this will be my fourth year, as a school counselor. I also have 2.5 years experience working for a behavior health for an insurance company. I was doing utilizational reviews as well as case management. And I've also worked in the nonprofit sector in a community clinic while I was getting my LPC intern hours, as well as um, a couple of months doing some case management for a nonprofit. So that's a little bit about me. Currently, teaching adjunct as well as working for Dallas ISD. I work for elementary Montessori campus close to my home. I live in East Dallas, which is about 6 miles east of downtown, close to White Rock Lake. Some of my hobbies: I am an avid runner. I completed my sixth Boston Marathon in April, and I'm currently training for the Dallas Marathon. I have a 3-year-old beautiful girl. Her name's Ruby. Um, and I guess, as far as my theoretical training, I am kind of like Corey in the book, that the author of the textbook. I would consider myself an existentialist, and hopefully you'll learn more about kind of that theoretical framework. But just to give you an idea, going through the master levels and reading some of the textbooks, one textbook that really stood out was The Man's Search for Meaning by Viktor Frankl. And just to give you kind of a Cliff Notes version, he was a Jewish psychiatrist that went through the Holocaust, lost his family. He pretty much was the only survivor, and he wrote this really influential book. And it basically talked about what he went through and kind of his search for meaning. So for me, as an immigrant child growing up, and kind of seeing two worlds, that really influenced me, and it created a lot of meaning, and it created a lot of whys, and that kind of really created a framework for myself, not only personally but also professionally. So, when I say my theoretical framework is existential, I think it's just referring to kind of how I approach some of these cases that I deal with. And thinking back in the schools and thinking back kind of in a clinical setting, you always want to have that conceptualization. You always want to have that plan of action, because that kind of forms your base. And the techniques that you pull, for example, a Gestalt technique or an Adlerian technique, all of those are great to use with certain populations that can benefit from it. But I really think that base has to be there, and that conceptual understanding really has to be there. And that's why I think theories is such an important course. And not only understanding the gist, yes, we can go through tests, we can give you the basic knowledge, but I think really internalizing that. And, as a master level student, my expectation is that really that intrinsic motivation should be there, and it's not just about a grade or whatnot, but it's really more about how can I be the best clinician that I can possibly be in order to affect change, and really affect level 2 change, not just artificial change, because that's, as a clinician myself, that's kind of what I question when I sit down with a client, or even a child. As a school counselor, we're not necessarily doing their clinical therapy, but we're really doing more of a behavior intervention. But even at that level, I think if we don't have a theoretical framework and we don't have a conceptualization of what we're doing, it's really easy to get lost, and it's really easy to, um, just be very unprofessional. So as I was reading chapter one, I really like this case study, and like I said, with Dr. Corey, I think um, he's also an existentialist. So, you know, um, I've actually met him at a conference, and I got to hear him out, and he's a really good speaker if anybody ever gets a chance. But I really like the case that they presented in chapter one. So be familiar with that case, be able to kind of identify the different variables of the case and kind of the different themes, and just think as a beginning counselor, um, how does this theory pertain to the case? Because every theory is different, right? And some theories, maybe if you don't identify yourself, like I don't identify myself with object relations, but I've used some of those techniques that I bring in when I'm working with different clients. Um, so moving on to chapter two, just to kind of give you a gist. Again, I expect everybody to do the reading and to be able to apply those readings and those concepts. But just to kind of give you a skim, be sure to know the characteristics of an effective counselor. Just being in the field for, gosh, close to 10 years now, I could tell you it's really easy to lose yourself. You're working with volatile, um, high risk individuals, and many times you don't have the luxury of having support. You don't have that luxury of having other counselors that you can consult. So really, it really takes somebody to have the boundaries, to have that therapeutical framework, and that's kind of personally, that's always something that's in the back of my mind. So be sure to read those characteristics. I think Corey did a really good job in identifying those. Be sure to really understand how the different things like boundaries, like um, self-care, like cultural, and I would, to go along with culture, I would say language, really influences kind of where a client is coming from. So be sure to identify those, and be sure to understand how all that is impacted. Um, Corey does talk about multicultural, and I think every course, um, I guess theoretically, is supposed to talk about multicultural issues. And that's really a very general theme, but one thing that I really want to emphasize is that multicultural can be a spectrum. Going back to my dissertation, language, and from my research and from what I've investigated, language is a topic that has very little literature. Yet, how many individuals speak more than one language in this country? So to me, especially living here in Texas, it's almost a disservice to Spanish-speaking clients that we don't have more of a support network for them. So please, multicultural, make sure you understand the different variables, make sure you understand how that impacts the world of the client. Um, and, one of the things that, as a beginning counselor, um, and I think Corey really mentioned it, was the anxiety. Um, you know, I when I've supervised master level students at the doctorate level, as well as even now, one thing I would tell them is, you're not going to know everything. I had a professor, great professor. One of the things that he told me was, um, at the university level, you're going to learn about 25% of what you need to know. The other 75% is going to come from practice. And I think what he meant was, this has to be hands-on. This has to be in the field. This has to be, if a client comes to you and they're telling you that they cut and you have no resources to refer them, then you really need to ethically be able to be competent enough to work with that client, and you do that through the lifelong learning. So part of this process, and I think the textbook did a wonderful job, is really understanding that we can teach you the theories, we can teach you the main concepts here at the university, but 75%, give or take, is going to come from the field. But given that they're saying that 25% is crucial, because if you're going to the field without that 25%, that can really be a disservice to the population that you're going to work with. Um, one thing that really stood out for me when I was reading chapter 2 was the importance of self-care. One of the things that I've worked at the community level, and I've given lectures about, is something called financial counseling. And the University of Kansas State, they have a big financial counseling kind of department. And one thing that the research has supported is the idea that people in the helping relationship or the helping profession, they are money avoiders. They don't want to talk about money. They just kind of, pretend it's not there. But that can really have a lot of ramifications down the road. So part of self-care is really, being okay with things like your health, your money situation, your family, your healthy boundaries. All that is part of being a good counselor. If you're running into credit card problems, if you can't pay your bills, if your boundaries are not what they need to be, um, that kind of sets the tone for maybe somebody that would be unethical or not have healthy boundaries as a professional. And one thing that I would encourage everybody to attend, if possible, is I know in Texas, the Texas Counseling Association, they have an ethical board, and the board meets twice a year, and it's free to attend. You get CEUs, um, and they bring cases. And from my understanding, the top violation of ethical standards is unhealthy boundaries, where counselors have unhealthy relationships with the client. So, that's kind of a big no-no. But really, I think it starts with self-care. If a counselor is not able to establish those at the professional level, if they're, being money avoidant, kind of like when I was talking about Dr. Kohler at Kansas State, then really, what can you expect at a professional level? And we'll talk more about ethics with chapter 3, but I really want to emphasize, reading chapters 1 and 2, make sure you know about that case, make sure you know about characteristics of a good counselor, because, I want everybody to be the best counselor they can possibly be. And part of that is that self-care, part of that is that motivation. So I look forward to hearing or reading about the discussion boards this week. If you have any questions, you can put it on the discussion boards. I know I've been working on the dates and fixing some of the um, what the course looks like, but please look at the syllabus, look at kind of what's due each week, look at when the tests are due, when the papers are due, I'm not much of a reminder. Like I said, I kind of expect everybody to be intrinsically motivated at this point. So, um, I mean, I'll try to remind everybody, but I guess I don't feel like it's my obligation. I really want to present as much information as I can, and I want to be as helpful as I can. So, on the video, I'll try to address any questions. I'll try to kind of give a highlights of each chapter that that kind of stands out for me. And what that means is that's part of what I'll be looking for some of the tests that we'll be giving. But again, we can test you, we can give you these multiple choice tests, but at the end of the day, um, that's just basic knowledge. I really want to go beyond that. I want to go, how can this student be the best counselor possible? Because we need good counselors. This, I think, as a society, we need people that can um, serve and help a lot of individuals that are struggling, because there are a lot of individuals that are struggling in this country, and um, that it's not just passion. It's more than that. It's passion, competence, um, knowing what healthy boundaries are, and etc. So any questions, feel free to put it on the discussion boards. I know I'm working on changing some stuff up, so please be patient with me, but I hope you've enjoyed this video, and I'll be sure to make some as we go along and we move through this course. Okay, well, thanks again, and welcome to Counseling Theories.